branch on the rostral part of where you just removed the horn and on the ventral part. Has to do with how that blood is getting to the horn. You can see your inferior alveolar artery right here, which is a branch of the maxillary there. And we'll use this image to point something out today that we'll talk about more on Thursday. Does everybody see this region right here, where we have multiple dorsally directed branches coming off the maxillary artery, and then it goes into this squiggly mess right here? Not a very good anatomical descriptor, but I think it gets the point across. This structure is called the rete meridulae epidurale, and we'll talk about it later in more detail, and I'll spell it out on a separate slide. But just so you can make your note here, this is your epidural rete meridulae. Plus, it's kind of fun to say. It's on a separate slide, don't worry about it. Just put rete, and I think that'll be enough mental note to get you caught back up. Plus, it ends up being like that long if I write it out. It's very long name. Okay, small ruminant. Guess what? Things are different in the small ruminant compared to the large ruminant. Just like the large ruminant, the extracranial part of the internal carotid artery degenerates postnatally. On this particular image, they didn't even indicate the presence of an internal carotid artery ever. So in the small ruminant, you'll still have this ligament associated in that general area where I just drew the blue line. The external carotid artery then, we'll follow it out. We've mentioned this before, but the small ruminant does not have a facial artery. Therefore, no linguofacial trunk can exist. Our first ventrally directed branch off the external carotid is lingual. We'll follow now those two dorsally directed branches from the external carotid. What's the first one? Caudal auricular. Kind of sensing a strong pattern here. What's the second one? Superficial temporal. What's a branch from the superficial temporal? Transverse facial. Now, in the case of the small ruminant, the transverse facial is a lot larger. And it's larger because there's no facial artery. So this transverse facial artery is helping compensate for that absence. The other two arteries that are a bit larger here in the small ruminant to help compensate for that absence of the facial is going to be the infraorbital and the malar contribution. Okay. Why don't you take a minute and see if you can, one, identify these vessels. This is from a horse. And if the vessel is associated with a guttural pouch, could you try to indicate which guttural pouch it would be in? Okay, what'd you come up with for number one? Common carotid? I like it. How about number 2? Internal carotid. Number 3, external carotid. And then number 4, linguofacial trunk. Now let's look at this external carotid artery on this angiogram a little bit. You can see we have one dorsally directed branch right in here. What would that one be? Caudal auricular, right? What's this next dorsally directed branch right here? Superficial temporal. That means that after that artery is branched off, this is now maxillary. The problem is when you're viewing the artery within the guttural pouch, you don't really appreciate those dorsally directed branches. So it's either maxillary or external carotid artery in that lateral compartment. It has to do with the branching, but as a clinician you can't see that. So that's why I wanted to explain that a little bit better here. Okay, now look at the venous side of things. Luckily for us, a lot of the venous branching is matched by the arterial branching, or the venous is identical to it for the most part. And this diagram helps you appreciate that. There are a few structures here, though, in the horse that we do need to look at. These are deep facial venous sinuses. You'll notice I have a large dilation right here of several veins. From top to bottom, you have transverse facial, followed by deep facial, and then buccal. If we think about where these deep venous sinuses are, it will help us understand why they're there and what they're doing. These sinuses are medial or deep to the masseter muscle, and they're lying directly against the facial bones. If you look at a horse, a wild horse, they're supposed to be outside eating, grazing, all day long. Their head's buried in the ground, and they're chewing grass. So if you now think about venous return back to the heart, this can be kind of problematic. So by putting these venous dilations, these venous sinuses in between the bone and the muscle of mastication, every time that horse chews, you have pressure changes within the venous sinus. It's like a pump. It will help push the blood back up the neck. Not to be outdone, the ruminant has a slightly different take on things. We do have a sinus right in here, but they also have a plexus, a deep facial plexus, which is best illustrated right here. Once again, this is deep to the muscles of mastication and superficial then to the bone of the face. But if you think about it, they don't need as complex a system because ruminants go out, eat as much as you can, as fast as you can, retreat to the shade, and then finish chewing it. So they're very different modes of survival. So that's reflected here a little bit in the anatomy. I do want to spend just a moment on the facial vein of the large ruminant here. And we can see that in the case of the ruminant, I should say, our dorsal nasal vein is joining the facial vein. So that was different when we were talking arterial side. The dorsal nasal was coming from a different artery. Here, though, the dorsal nasal vein is joining the facial vein. After this, it's continued as angularis oculi. Once it's at the approximate location of the orbit, or really kind of dorsal to the medial canthus of the eye, this angularis oculi will transition to frontal vein. If you're going to be doing any surgery in the sinus system of the ruminant, really here the ox, you need to be aware of the frontal vein. You don't want to inadvertently cut into it, so that's why we're pointing it out here. Not going to go terribly crazy here on the pig. We do want to look at one venous sinus though in the pig, and this is the ophthalmic or the orbital venous sinus. Number 40 is that sinus. The reason why we talk about it, this is an area where you can obtain a blood sample from a small piglet. And what you would do is you would take a glass capillary tube and pass it between the third eyelid and the medial canthus of the eye back into this venous sinus. It's usually only done in research situations now because it's kind of unsightly. If you don't know what's going on, it looks like you're taking a glass capillary tube and stabbing a piglet in the eye. It just doesn't look very good. And there are other ways for us to get blood as well. But you'll come across that in some of the older textbooks and even some research articles. So we figured we'd talk about it. Okay, thank you so much for your attention. I got through the lecture. I'm sure everybody's aware the test is kind of coming up next Thursday. And so how this is going to work, I'll go ahead. Thursday's lecture is going to be included in the exam. On Friday, though, I assume that your dissection will be done for this part, because next Tuesday, your dissection needs to move into the thoracic region. So your written component for sure will be done on Thursday. You'll know exactly what's on there. And kind of the stick or the carrot, depending on how you want to look at it, that I kind of have to hold. If your dissection doesn't continue on Tuesday, then I can pin stuff on the thoracic region. So if everybody keeps dissecting into the new material, then the laboratory part is only on head and neck. I've never had to do it. People have always been really good about it. But I have a feeling if I didn't kind of keep on you, you would stop and spend all day Tuesday reviewing in the lab. And then we fall way behind. So, any questions? Thank you.